with all the rest of the speakers once after they've introduced themselves. So just some housekeeping rules. You would have noticed that all of you have been muted. We request that all questions be posed in the chat, and we will attempt to address all of those questions during the session. The slides to this presentation will be available on the GTAC website. Hopefully that's enough housekeeping. I don't think we need to do too much of that today. Anyway, good afternoon again. It is indeed my distinct pleasure to welcome all of you to this webinar today. We hope that during the session we are able to cast more light on the work of the Jobs Fund, and in particular the intervention which we're looking at today, which we're all very proud of, an intervention into the primary healthcare sector with our partner Unjani Clinics. Now, before I hand over to our facilitator for today, Hilton Sarukunda, I would like to provide a brief overview of the Jobs Fund and social franchising models in general. So the Jobs Fund was established in 2011 as a unit of the National Treasury and capitalized with 9 billion rand. And the Jobs Fund was established really within the context of persistently high unemployment in our country, and that, of course, persists to today. The fund was established to test and inspire innovation in a manner which addresses the challenges given government's constraints, particularly with regard to the lack of innovation and flexible public instruments, to leverage the private sector, something the Jobs Fund has been very successful in doing, and to test solutions to social challenges, of which there are a myriad of social challenges. Some of them seem intractable. We attempt to address as many of those as possible within our project. And of course, all of that happened within a constrained public purse. In effect, the fund can be seen as government's R&D pilot or research and development pilot, testing and learning from innovative job creation models through a process of risk sharing with our partners, Unjani Clinic being one of them, encouraging a wider adoption of the Challenge Fund instrument, through which the Jobs Fund is implemented, and encouraging the adoption of successful job creation models by other organizations, taking the learnings from what the Jobs Fund has implemented and then scaling that to as far as possible. Next slide, please. So the Jobs Fund, apologies, go back. The Jobs Fund does not in itself implement these various initiatives. The Jobs Fund works with intermediaries and thereby leveraging their networks and expertise to access and support targeted beneficiaries. We do so via 4 funding windows, each developed to address specific barriers to job creation. The first one on the slide there is the support for work seekers. We have a window dealing with enterprise development, one with infrastructure development, and also institutional capacity building. We often refer to ourselves as a learning fund. That's because one of the key foundational pillars of the Jobs Fund is knowledge sharing. The ability to achieve this goal is underpinned by a rigorous framework of monitoring, evaluation, reporting, and learning. Next slide, please. Now, today's webinar is really about social franchising, and more particularly an example of a project that has been implemented very successfully by the Jobs Fund. So what is social franchising? We know what franchising is. I think most of us do frequent franchises. But what is social franchising? Franchising in reality is started in 1950, is associated with scale replication via a franchisor. It's meant, in effect, and I know this has not always worked out perfectly, to reduce the risk of business failure. In the 1990s, this model was applied to social enterprises. In effect, social franchise is the application of the commercial principles that was applied to the franchise movement to promote social benefit rather than private sector profits only. The model, the social franchising model, is applicable to a myriad of issues, including education, healthcare, child development, to name a few. The social franchisor, in this case, collaborates with partners, the franchisee, to expand social reach or services to reach through via the franchisor or the franchisee, sorry. The inclusion in this model in the Jobs Fund portfolio is consistent with the Jobs Fund's focus of testing and innovation in the job creation space for those projects, including the social impact of those models, to demonstrate those, and as I've said, through process like these, showcase those, and eventually, hopefully, get buy-in from various organizations so we can scale such interventions. Now, the Jobs Fund has to date tested two social franchise models. The first one being the Smart Start Early Learning social franchise model, which is active within the education space, and of course the one that is the subject of today, Unjani Health Clinics. Now, just some notes on what and I'm sure the presentation will deal with this. The outcomes of the project has been exceeded. We've completed the first project. What we did was we empowered 44 unemployed nurses to open their own clinics. We've provided healthcare services to almost 12,000 patients within the communities that they operate, and showed a sustainable model for healthcare, primary healthcare within our communities. I now hand you over to our facilitator for the day, Hilton Sarukunda, who will also introduce the Unjani team. Thank you.
Thank you, Nazim. My name is Hilton Sarukunda, and I'm a team leader within the Jobs Fund unit of GTAC. For the same reasons that Nazim had, I'll also just switch off my camera and go through the content. Unjani Clinics is a non-profit company that implements the enterprise development initiative called the Unjani Clinic Network. Our journey with Unjani is one of the most successful of the Jobs Fund, and this partnership started in 2017, where Unjani applied to us and proposed to create a network of community clinics that are owner-managed and in low-income areas, largely targeting Black nurses. The Unjani Clinic project aims to attract qualified professional nurses to apply to Unjani to own and run a clinic. It is an innovative social franchising model that reduces the inequality which exists between private and public healthcare services in South Africa. I have been very fortunate to work with this project from the beginning right to the end, and I saw the impact that it has had on the ground, bringing healthcare closer to the people, private healthcare for that, through empowered nurses that would have been qualified and trained by Unjani and given access to the healthcare facilities that are required to help the communities in which they find themselves. Today, we are fortunate to have Linda Toysant, who is the CEO of Unjani Clinics, and one of the founder members of this program. I'll hand over to Linda to take us through the Unjani journey and model. Thank you. Over to you, Linda.
Thank you so much, Hilton, and good afternoon to everybody on the webinar. It's an absolute pleasure to be here. Just as with my other presenters, I will just say hello and then move across to my slides. So I'm going to turn my camera off. Thank you to the Jobs Fund for the opportunity and GTAC for the platform to present Unjani Clinics to you today. As Hilton mentioned, I am Linda Toussaint, the CEO of Unjani Clinics, the non-profit company that implements and manages the Unjani Clinic network. So Unjani Clinics empowers Black women professional nurses to operate and ultimately own a clinic in low-income and underserved communities of South Africa. And using social franchising principles, we're building a network of clinics that drives real value into the communities in which they operate through community upliftment, job creation, and enhanced access to quality, affordable primary healthcare. Next slide, please. So we know that our township economies are thriving. Every time I go into one of our townships, I see it. I see people busy going about their business. And we've actually seen the informal sector produce jobs despite job losses in the formal sector as a result of COVID. I was reading a recent publication by the CMO Council that reported that more than 60% of the world's employed population are in the informal or grey economy, with 93% of informal employment in emerging and developing countries. Interestingly enough, 85% of consumer purchases across Africa are being made from small or informal retail shops. And the proportion of unbanked adults is decreasing worldwide due to the advent of digital payment and fintech innovations. So this is no different in South Africa. And the article concludes that micro enterprises may soon be the mega enterprises of tomorrow. And so hopefully, with that as background, I can let you know that Unjani focuses on the employed, uninsured population of South Africa, providing this portion of the population an affordable, alternative choice of primary healthcare service from passionate and empathetic Unjani Clinic nursepreneurs. And over the past 10 years, we've demonstrated a successful business model and now have a network driving annual revenues of over 200 million through the million consultations delivered through that network annually. And given our target market, which accounts for approximately 25 to 30% of our population, we need to make more of an impact by driving more facilities into rural and underserved areas, hence our very brave expansion plan to 2030, which requires us to open a total more than 600 clinics by that time. And that also gives us an incredible platform through which we can play a role in national health insurance service delivery. Next slide, please. I think it's no secret that more than 80% of our population is dependent on an overburdened public healthcare system. Our doctor shortages, and in fact, the most recent GP ratio of 0.1 to 1,000 is increasing. It's not improving. And the economic and political uncertainty seems to be driving more of our healthcare professionals abroad. So the need to task shift to highly skilled primary healthcare nurses with referral outside of their scope of practice is foundational to solving our access problems. Next slide, please. So this map shows or depicts our national footprint, representing 135 facilities as at the end of October 2022. Our aim is to bring an Unjani clinic into a community and thereby reducing travel and wait times. We also want to deliver quality, affordable, convenient community impact. And so you can see here where our focus is to reduce the wait times, to reduce the walking distances, to improve the convenience of our patients, and to really focus on affordability and quality through our consultation fee, including medication and diagnosis. Next slide, please. So really, what is it that we do? Why is it that we do what we do? And so we always have to look to the Sustainable Development Goals, and with those in mind, it's about focusing on SDG 3, which is good health and well-being, through providing community access to affordable quality care. It's also about number 5, which is gender equality, and that's about creating business opportunities for women. Number 8, which is about decent work and economic growth, and that's about creating new meaningful jobs. And importantly, number 17, which is partnerships for the goals. And it's really about achieving the impossible through collaboration, such as the work we've done with our partners in the Jobs Fund and will continue to do. Our impact to date, which you see here on the right-hand side of the slide, is testament to our vision of making an impact, one patient at a time. And so to date, we have empowered more than 120 professional nursepreneurs. We've created in excess of 535 jobs, permanent employment in those communities. We've deployed over 150 Yes learners into our network over and above the employed people. We've provided more than 3.2 million consultations since our inception, and we've raised over 200 million in funding in order for us to deliver what we have to date. Next slide, please. It's always good to look back at your journey and recognize all of the learnings along the way. And our journey began in 2010 with Dr. Ian Barton, who birthed the idea of Unjani Clinics and the need to task shift primary healthcare to professional nurses and provide alternative models of care. So at that point, 6 clinics were pilot tested between 2012 and 2014 on a franchise basis. And I can report that one of those pilots, opened in 2012, October, has just celebrated her 10th anniversary with the network. In May 2014, Unjani Clinics NPC was established as a separate legal entity, a non-profit company, specifically to fundraise for, implement and manage the Unjani Clinic network. And the NPC is also a public benefit organization, and for BBBEE purposes is a qualifying small enterprise. All our clinics are implemented on an enterprise development basis using social franchising principles, and the nurses are clinic operators until ownership passes after their 5-year enterprise development program. By December 2019, there were 70 clinics operating in the network, having successfully deployed 44 clinics under our first Jobs Fund project. And the millionth consultation was actually celebrated in September 2019. We are currently in the transition to scale phase, and we achieved our 100th clinic milestone in December 2021. The move away from a fully donor-aligned funding model to one of a blend of grant and loan is also being currently tested. And this will form the basis upon which we will scale the model moving forward. And as we've journeyed along this path, we've learned to be resilient and agile in our approach, and in this way have achieved sustainable impact. Next slide, please.
Linda, shall we just pause a bit and take 1 or 2 questions? I see there's a question in the chat from Mandisa. Mandisa's question is, what made Unjani Clinics choose social franchising over any other model delivery?
Thanks, Mandisa. So I think one must look at it from what service is being offered. If it's a social service, then taking a pure commercial stance is not really appropriate. We were clear in our objectives from the start. We wanted to build a compliant network of clinics that offered quality services at affordable prices and at a high standard. But we wanted to build up Black women professional nurses to lead their communities and take up the healthcare banner to help improve health outcomes in their communities. So we wanted them to own this responsibility, and this can only be achieved through having a vested interest in what you aim to achieve. So franchising principles made the most sense for us. A common brand that is recognizable to the communities we serve, who can then associate that brand with standards and pricing and expect a high service delivery. We could have considered an owned model and employed the nurses to run our clinics, but how would that have been different to so many employed models? We wanted to be different. We wanted to disrupt. We wanted to really uplift nurses, their communities and the people they employ. And by elevating nurses who live in our communities and providing them with the tools to empower themselves and their communities, you drive responsibility right back to where it belongs, and that is in the community. So the only model that really made sense to use was to have a non-profit franchisor who drives that social objective and have social-minded yet commercial franchisees at the front end delivering the vision.
Thank you. There's another question from Buyo. Buyo asks, how many consultations do nurses need to have roughly to break even on a monthly basis? And are the clinics meeting these numbers?
Great, thanks, Buyo. So the way that we have looked at it is quite simply on the most important thing for us is really about sustainability. And I think, it's important for us to always bear that in mind when we open a clinic. So one of the questions that I will ask a nurse in her interview after she's just done her clinic or her community survey is to say, how many patients, based on what you have heard from your community, do you think this clinic would be able to see on a monthly basis? And generally, in the main, the answer is 20 plus. And so the model, our model itself is built on the fact that you need to see 10 patients per day in a 25-day working month, which is 250 consultations a month. And if you can do that, then you are driving sustainability. And when you go beyond that number, you're driving profitability. So in the main, our nurses would have seen, would get to that point within 18 months. Most, if we've, in the more urban areas, you could be doing that in the first 3 months. But in the main, within 18 months, the nurses have achieved those required numbers. And so we measure that, we watch that very, very carefully as a team to ensure that we get them to sustainability as quickly as possible.
Thank you, Linda. I know that when we're implementing a project, this was one of the key project-specific indicators that we tracked, and the project met that on all of the nurses that were in the program. There's a next question from Eric. Eric asks, how does this compare to Quali Health, and is there opportunity for collaboration between Unjani Clinic and Quali Health?
Eric, thanks very much for the question. I am aware of Quali Health. I really liked the model when it initially hit the market. And it's, a wonderful doctor that has come up with the model. I've unfortunately seen closure of Quali Healths, which is unfortunate for the communities. It did, however, fortunately for us, open up an opportunity in Alex. However, we've always looked at it in terms of a non-siloed approach. So if there is an opportunity to collaborate in any way to improve our delivery of service to our patients, we're there. So absolutely opportunity to collaborate and would value an introduction if that was required.
Thank you. We'll take Fidelis' question and then move to the next set of slides. The question is, to what level or scale of patients served has the most successful clinic reached? Do you expand the infrastructure or capacity to match the need?
Hi, Fidelis, and thanks very much for that question. Absolutely. So our largest, or our most, I wouldn't call it successful because it does depend on populations, but the clinic that has seen the most patients is about 3,000 patients a month. Absolutely, we would expand that facility. So when I did my introduction, you may have noticed a container clinic behind me. We specifically use containers because they are modular. We can extend the infrastructure by adding on additional consultation rooms. And so in order for us to keep our wait times as low as possible, we would then be able to add consultation rooms, and the nurse, empowered nurse, is then able to employ more nurses to work alongside her. So in both cases, yes, we would do the expansion of the capacity, both with the nurse as well as the actual infrastructure.
Thank you. Can we move to the next slide? Thank you.
Thanks very much. All right, so now I'd like to focus in on the Unjani Clinics Jobs Fund project that began in January 2017 and ran to December 2019 with 2 years post-implementation reporting. We implemented 44 clinics in the project period, trained 108 beneficiaries, and created 131 permanent jobs, achieving or exceeding all the targets within the original budget. And this goes to one of the questions that was just raised. The average permanent jobs created during the project was 3 per clinic, and the average now is nearly 4, which shows constant growth and further employment opportunities in those clinics post-Jobs Fund project. The wonderful thing about the Unjani Clinics model is that it's about achieving sustainability, as I mentioned, and then growing and building on that foundation. And as you can see on the graph in this slide, the 44 clinics have continued to add more permanent jobs, train more beneficiaries, and most importantly, attract more business. So through the Jobs Fund clinics, over 1.4 million consultations have been delivered. And the economics are astounding. So the Jobs Fund grant and the matched funding was just under 50 million rand, which invested in those 44 clinics. They have delivered revenues of over 225 million. So it's almost 4.5 times that investment. And we've created permanent employment for 170 community members to help sustain their families, which if you extrapolate that on the 1 to 4 basis, would have positively impacted 680 people. In addition, if one looks at the investment to consultation ratio, so that is if you take the original investment and divide by the cumulative consultations that have been delivered through these clinics, the result is 36 rand. And that's incredible. So, you know, in terms of, if you look at it from an NHI perspective, if you look at it from an investment perspective, that's really what you've got to look at is, yes, we've empowered 44 incredible nurses to run their businesses in their communities, but it really ultimately has to be about the patient. And if you think about it, it's a very low investment to have made to see that impact on the patients that have been served through these clinics, only 36 odd rand. Next slide, please. All right, continuing with the impact from the Jobs Fund project, it's always important to look at our focus areas, and we have a few, one being the employed uninsured, but also underserved and rural communities. And this slide shows the classification of the Jobs Fund clinic areas based on population numbers. So we know that the severe strain that our government health systems are under. We also hear all the time that there's no budget to properly strengthen the system. So the private sector has a role to play. Unjani focuses on enhancing access to quality, affordable primary care and building capacity in the government facilities by drawing patients away that can afford to pay a reasonable out-of-pocket contribution, and thereby decongesting the government facilities to deal with the unemployed population. So the Jobs Fund project took us beyond Gauteng, where we opened 6 Jobs Fund clinics, but also then into more outlying and rural areas and other provinces. In the Eastern Cape, we opened 5. In the Free State, we opened 2. In KwaZulu-Natal, we opened 10. In Limpopo, we opened 10. In Mpumalanga, we opened 7. In the Northwest Province, we opened 3. And in the Northern Cape, we opened 1. So we almost went national with the Jobs Fund project, but we just missed the Western Cape. And if one looks at the graphs on this slide, 88% of the clinics opened are classified as rural by population statistics that surround the 5-kilometer radius of that clinic. And the populations that surround these clinics account for about 5.8 million people. And with the 1.4 million consultations performed to date, we are seeing that we are making an impact. But what was also surprising was that the rural clinics' average monthly consultations are on par with, if not far from, their urban counterparts. And this is testament to the need in our rural and underserved areas, as they don't have the choice of providers that urban dwellers have. Next slide, please. So before the Jobs Fund project started, Unjani had piloted 6 clinics. We'd rolled out a further 22, but I can honestly say that the Jobs Fund project leapfrogged the network to the 70 clinics in just a few years. Since then, we've continued to grow, and at 135 facilities now, we're ready to do another Jobs Fund project, with a few new nuances to the original model and a few additions to our thinking. The graph on this slide shows our projected journey to the end of 2025, which will include another 2-year Jobs Fund project, which kicks off in January 2023. Under this project, we'll implement a further 40 facilities, create 90 more permanent jobs, and train another 120 beneficiaries. And then beyond that, we will continue to grow and scale as our plans are to get to that 600 plus clinics. On to the next slide, please. So as seen from the previous slides, our journey continues to 2030 and then, God willing, beyond. Our rural focus will remain. We will continue to focus in this area, with more than 80% of the areas that we'll open clinics in being rural or underserved. We'll deliver over 600 facilities into communities, delivering in excess of 22.5 million consultations cumulatively through the network at scale, which will at scale be approximately 5 million consultations annually. And we'll drive access even further through differentiated services, taking a holistic view of the patient and providing integrated care. Next slide, please. Continuous innovation is required to ensure that we meet the requirements of our clients, and patient-centered care entails holistic and integrated care in order for us to live up to our brand, "How are you?" and the fact that we do care more. We are in the process of implementing additional services, partnering with other organizations and professionals to achieve this holistic view. And collaboration and non-siloed thinking also achieves these objectives much more quickly. So in the last short while, we have been piloting dental, mental health, and vision care in our clinics. We've also launched virtual consultations alongside our partner Intercare. And here what we've done is we've integrated the virtual consultation platform into our WeCare patient management system, and that allows a nurse to be able to dial up a doctor when she's outside of her scope of practice to deal with the patient, and they would not have to leave an Unjani clinic to do that. In addition to that, and as part of our next Jobs Fund project, as an expansion of service reach into our rural communities, we've introduced Unjani Health Pods. And so that will help deal with areas where they are too low populated to commercially support an Unjani clinic, but would be able to then deal with the needs that are in those particular areas. Next slide, please. I think in this day and age, environmental and social governance is top of everyone's mind and critically important. So what we do and why we do it needs to be measured and managed. And so a lot of these statistics you would have seen, but we've created in excess of 535 jobs. We create up to 5 jobs plus, and in fact the question around the clinic that did the 3,000 patients, I think their team is 9 people, and sometimes more than that, because they get very busy at certain times of the month. We've empowered the 120 plus women. We've created economic stability to households with children. We've really focused on enterprise development. We, under the most recent project that we've done, have established Unjani SPV, which is a special purpose vehicle that will house enterprise development loans and allows our nurses to apply for interest-free loans in order for them to expand their businesses in-house. And then we have also, very importantly, we're looking at energy efficient consumption. We're also looking at, the fact that we use containers. It's effectively recycling of a very high steel content product. On to the next slide, please. So as part of our WeCare system, which is our patient management system, we are about to launch off our WeCare tech platform, our patient app, which we're very excited about. So this enables various features, including the ability to make appointments for certain lengthier procedures, such as ultrasound, circumcision, or seeing the dentist, downloading relevant disease or condition educational content, receiving chronic treatment reminders to drive compliance, and most importantly for me, a live service quality rating system, which allows our patients to rate our services the minute they walk outside from their consultation. And so driving quality in so many more ways. And it's also in line with our slogan, "We care more." Next slide, please. So none of what we've been able to achieve to date would have been possible if it hadn't been for our partners and funders that are reflected on this slide, and we're eternally grateful for them, or for their continued support. And none the least of them is obviously the Jobs Fund, and thank you again for the opportunity today to talk around this project. Final slide, please. So this slide gives you an idea of our facility types. The typical semi-rural clinic, which is fixed in our communities. At the top of the slide is a Ford mobile conversion we tested in 2 outlying areas, and the latest addition, which is down in the bottom corner, the Unjani Health Pod, which is an extension of our service for clinics in rural areas. It's effectively a consultation room on wheels, and those will be the 2 on the left-hand side are effectively the facilities through which we will deploy our services in the future. But Hilton, before I hand back to you to introduce Sister Raisetja France, who is a Jobs Fund beneficiary, is one of the nurses that have made us proud and delivered the results that we show on these slides as a result of her participation. I'd just like to tell the audience that she has just been awarded the winner of the Women in Health at the She Millionaire Summit recently. And I can't tell you how #Unjani proud we are of her, and many of the other nurses in the network who have also been recognized for their contributions. But today, we particularly recognize Sister France's achievement. And back to you, Hilton. Thank you very much.
Thank you, Linda. Very, very exciting news. Well done, Sister Raisetja. Sister Raisetja France is one of the beneficiaries of the Jobs Fund project, one of the earliest ones at the very beginning of the implementation of this particular project with us. She opened the doors in 2017 in rural Chamane area in Mokopane, Limpopo. Since opening, she has seen tens of thousands of patients in her community. Sister Raisetja, let me not steal your thunder and hand over to you to take us through your journey, where you are, and the future for you.
Thank you so much, Hilton. I would like to greet everyone on this platform, and I'll go back to muting my my camera, if that's okay with you. Okay, as they have already introduced me, my name is Raisetja France. I'm a professional nurse based in Unjani Clinic, Tamahanzi, which is in Mokopane, which is about 2 hours away from Pretoria. It's predominantly rural, and we are surrounded by 2 mines, which is Mogalakwena and Ivanplats mines. I'm a professional nurse who started this journey in 2004 as a professional nurse working in different hospitals and in all levels of care, from primary health care to level 3 hospitals. So I've worked for about 15 years as a professional nurse. And when the opportunity came, where from my friend who told me about Unjani Clinic, I became so excited because I was already becoming so frustrated with working in government sector. we all know the challenges that are there. So my journey with Unjani Clinics started in 2017 in October. And being in a rural area, I'll just explain briefly my journey. Being in a rural area of Tamahansi, it wasn't easy, of course. From seeing 0 patients some days to seeing 2 or 3 patients some days, and to now seeing hundreds and hundreds of clients, it's heartwarming. I feel so blessed. I feel privileged to be able to offer these services. And I'm truly, truly grateful to Jobs Fund. I'm truly grateful to also Unjani NPC, specifically to Linda and Sue, who are very, very supportive. And honestly, if you send them an email now, they'll definitely respond within minutes. I don't know where they get the time, but I'm truly grateful to be in this network. And yes, from being just a professional nurse working in government to now being a businesswoman and being recognized as a businesswoman, it's truly humbling. I didn't know as well when I was chosen to this, as Linda has already mentioned, the Africa Summit Awards. I was humbled because sitting in your corner in a rural area, you don't see. Sometimes you feel like you're boxed somewhere, but you don't realize the impact that you make. And to being chosen by one of the random person that I've met and who has seen the impact that we make and decided to put my name up front was really, truly humbling. And through Unjani Clinic today, I can say I'm a businesswoman. And because we are surrounded by mines, I was also privileged enough to be approached actually by Ivan Platt's mine in 2020 at the peak of COVID, who asked me if I could come and do their COVID tests. And today we talk to the mine. I'm able to sit in their management meetings to discuss how else they can help the community through me or through Unjani Clinic Tamahansi. So we've built other partnerships with the local community, the Indunas. As you know, in a rural area, we are governed by the Indunas. So it's so humbling when they come to you and ask you to help, or rather ask you if they can help or put a hand in whatever that we want to implement. So so far, we have 5 permanent staff at our clinic. We see hundreds and hundreds of clients. And we also have, besides the 5 permanent staff, we also have around 4 locum nurses. So usually in the beginning of the month or towards the end of the month, the clinic might become a little bit busy. So we need extra hands. So that's when we call the locum staff to come and help. So I'm truly grateful for this journey, and thank you so much to Jobs Fund for this opportunity, and thank you to NPC. Unjani. Hello?
Thank you, Sister Rasecha, for sharing with us your journey. It is truly humbling for us to know that we have impacted so positively in your life and in the community that surrounds you. Wish all the best going forward.
Thank you so much.
Yeah, the impact of us being involved in just 44 clinics and reaching over 5 million people in different communities in the breadth and width of South Africa is something that we live for as the Jobs Fund in terms of development. I see there are no further questions on the chat. Just, really complimentary messages. There's one question from Kath, where she's asked, please tell us more about your innovations, particularly the app and your anticipated uptake of people using the app. I think this is a question for Linda.
Thanks.
And also your move to providing mental health services did this stem from the pandemic?
Okay, great. So let me deal with the innovations, and the one innovation is obviously the health pod, which I spoke about, because we were constantly looking at areas where we know that there is a need for healthcare, but we also need to balance the sustainability and the commercials of the clinic versus, you know, that ultimately need. And so the idea was to bring in the health pod, which will feature in our next year's Jobs Fund project. Really, it's about taking an existing Unjani clinic and enhancing their reach. So if you, for example, look at where we've tested this in Limpopo, you've got a clinic that has a, let's say, 15,000 people reach in a 5-kilometer radius. If you go to 25-kilometer radius, which is still achievable with the pod, and you are able to get there and back in a day, you are looking at a 5 times reach. And so those clinics, and very often it's, you know, numerous clinics. It could be 25 clinics or villages that surround that particular area. And so if you can meet the needs of those people, not necessarily on a full-time basis, but you can get there quickly and back, and you can actually refer them into the main clinic if they require other services. It just enhances the extent or extends the services to those particular communities. So the health pod is one of the innovations. And then if we look at our other innovations, which are the additional services, the question comes around mental health in particular. Yes, and mental health is often undervalued. It's people poo-poo the fact that people have mental health issues, and I think it's incredibly important. We've seen it just because our nurses often would have a consultation without any medication dispensed, and we'll query that, and the nurse will tell us they had a consultation with a patient, they just needed to talk. And very often we just need to be able to listen to people. And so we've started that initiative working alongside another organization who will provide these services, because our nurses are not, while they might be psych trained, they have to work alongside a psychologist and a psychiatrist. So we are working alongside an organization that can provide those skills, and we're going to test the mental health. But it comes from it was heightened by the pandemic. But also recognizing that our healthcare workers, the people that work in our clinics, need their health taken care of and their mental health taken care of too. And so we really are looking forward to the outcomes of that particular project. Just in terms of the app, so we have spent probably the last 18 to 24 months, and the nurses who are on this call will be a testament to the patience that is required, and that's not patience with a T at the end, it's with a C, from their side, as we've tested enhancing our patient management system, which is the actual system that the nurses run their clinics on, which is very technology driven. We've got a fantastic WeCare system, which is busy working at the moment, and as an enhancement of that system, we reach out to our patient through the app. And it allows the patient to update their own details. So if you consider Poppy, it's not somebody else that's got access to their details. They can update it on their phone, and it will then update the system. So if somebody got married, they change their surname, rather than us going through this whole process as they come and visit the clinic again, they can do it themselves on their own profile. And so it is about making the consultation process and the queuing process as short as possible, and really being interactive with our patients and our clients that use our clinics. I think in terms of the uptake, so we've done some research. We've got an amazing marketing company that we work with, and they've done some incredible research around would people use the app. And I think we obviously see that more and more in our young populations. They are more tech savvy, and they are more driven by the use of apps. And we've tried to make the application as data light as possible. And you download it from the Google Store. So it's Android, not iOS enabled. It works on the Android platform, which is most relevant to our populations that work with us or visit our clinics. So we really have tried to make it as interactive as possible and as valuable as possible. It's not just one of those apps that you download. So yes, I think I addressed those two questions.
Okay, I've got a few more questions. One is from Sonko. So this is similar to what Fidelis had asked earlier on. He says, in the cases where the clinic has increased the number of people employed, is this also meant that the infrastructure or the floor space has also been increased?
Yes, it does. And so when you get beyond a certain number of patients and the queues are getting too long, you need to firstly bring in another nurse to help manage the load of patients so that the patients aren't queuing for long periods of time. But you also need to then increase the actual infrastructure. So invest in additional container space, which would include, consultation rooms. We generally build the clinics so that the nurses grow into them. Within a typical semi-rural structure, you should be able to be seeing 1,000 patients a month before you expand it. But many of our nurses will expand earlier than that. But at 1,000, you should be able to see the patients through that particular structure.
Thank you, Linda. The next question is from Vuyo, and it's really about downstream impact of the project. And the question is, are there small mobile businesses emerging around the clinic sites in the communities you service?
Well, I'm not certain. I think when you talk about mobile businesses, so maybe little shops that open outside the clinic areas, I think when we look at our particular sites, we look at busier sites, and very often those smaller businesses may already be there. We often near a taxi rank, so that commuters can get to the clinic easily. So there's generally a bit of hustle and bustle. But I would imagine that would be an iteration, that our clinics would attract other vendors to see the clinics, to see the commuters as they walk past the clinics.
Thanks, Linda.
May I also add to that, because of the impact that we make, and there's recently, actually last week, I was approached by one of the entrepreneurs around, and he was suggesting that he would like to open a lab around the clinic, just around the clinic and other businesses. So I think the impact of the clinic also makes a huge difference, because now suddenly people start seeing opportunities because they realize the impact that the clinic has around the community. Thank you.
That is amazing, Sister Rasich. There's a question from Eve. Eve is asking, with the inclusion of psychologists and doctors, do you expect the pricing model to change?
So Eve, that's unfortunately the reality of life. So we will obviously keep our consultation fees as low as possible in terms of our nurse intervention. When you do bring another specialist or professional into the mix, there will be an increase in the price. There's no question, because you've got two health professionals that then need to be paid. However, it really is about the efficient use of the professional's time. And so with the Intercare model, we have tested a 350 consultation, where that you would see, so the nurse would do the majority of the work and receive her consultation fee. And because the doctor would have been, the nurse would have informed the doctor of all of the workup she had done and sent him the necessary notes. It's a quick intervention with the doctor if required. Otherwise, then there's more of a referral. So we've tested at a 350 rate as opposed to the 250 rate. And the psychologists, again, it does depend on their time. Here, not necessarily would the clinic, the Unjani nurse be involved in the actual consultation. The psychologist would be paid for their time by the patient, but we would, again, based on the volumes, try and bring that pricing down. So always in everything that we try and develop and enhance in our communities, with the patient in mind and with cost effectiveness in mind.
Thank you, Linda. I don't see further questions. I will hand over to our DDG, Mrs. Najwa Ali Edris, who's also the head of the Jobs Fund. Najwa is also the project officer for research program on employment, income distribution, inclusive growth in partnership with the South African Labour and Development Research Unit at the University of Cape Town. She was also instrumental in the designing of the Residential Youth Employment Initiative and is now responsible for overseeing the implementation of the National Youth Service and the National Pathway Management Network Innovation Fund. Najwa, I'll give it to you to close the
Thank you. Thank you so much, Hilton. And thank you, Linda and Sister Franz. You know, what a way to have a Friday afternoon. What a way to bring to bring this week to an end. I remain in absolute awe of the work that is being done, humbled by the commitment of our Jobs Fund partners, humbled by the work that Unjani does. When I listen, hope blossoms for our country, because this is the people of our country making things work and making things work despite the odds. How often have we read articles about we need to do more within the primary health sector? We need to bring healthcare to our communities. Well, this work presented by Sister Franz and Linda this afternoon is a demonstration that this is possible. And it's possible through collaboration of many partners, but also through the commitment of the people who have the vision to bring this to a reality. And so I am very, very thankful. It also demonstrates the versatility of a Challenge Fund instrument. And to that, I have to thank the National Treasury for the vision that they had in respect of establishing the Jobs Fund as a challenge fund geared towards achieving social impact. But as demonstrated by Linda and Sister Franz this afternoon, also providing economic returns. It also provides opportunity for innovation, bringing digital technology to support excellence in primary health care. So I continue to be in awe. I continue to be humbled by the willingness and the commitment of everybody in this ecosystem who is willing to say, well, we have a lot of problems in our country, but this piece is within my control. This piece is within my circle of influence, and I'm going to do something about that. So we need more South Africans to do this and to be committed to revitalizing our country and making it a place for all South Africans and others to feel safe, to feel secure, and to have access to having their basic needs addressed. So again, I want to say thank you to GTAC for the platform. I want to say thank you to the National Treasury. I wish all the budget analysts of the National Treasury was present this afternoon just to listen to the impact about how we can use public funds for greater good, how we can leverage limited public resources when we partner with others. Importantly, I also want to say thank you very much to my Jobs Fund team. Often unsung heroes, but a group and a team of people who forge ahead, keep their heads down, and continue to do the good work that they do. Again, thank you so much, Linda. Thank you so much, Sister Franz. I wish everybody a wonderful Friday afternoon and happy goosebumps and reflections to see what is possible when we all come together with common purpose. Thank you.
Thank you so much. We really appreciate it.
Thank you very much. We come to an end of our webinar. Thank you all for attending, and
Thank you.
to our partners.
Thank you. Thank you, Hilton.
Yes. Thank
Thanks,
you.
Hilton. Thanks,
Yes.
everyone.
Bye.
Thank you.
I'm making a movie of this. Definitely featuring on YouTube
Thanks,
and other
colleagues.
places.